Thank you. So I'll start off by saying that race, again, as we've heard, is not biologic and there's no genetic basis for it. And when we do study race in any research we're doing, we should attempt to specify the reason for race in that study, not just for convenience, even if it involves funding requirements. Important to include how race was identified and the source of the identification, whether it's by self-report or investigator observed or from the electronic medical record. Important to also specify racial and ethnic categories and to avoid the use of terms like others unless that's the way it was pre-specified in the data. Also avoid terms like minorities, and it's important to use the modifier like racial, ethnic, minority groups. Better still, if appropriate, to use the term underserved or underrepresented population. Now on disparities, it's important to report on healthcare issues from a systemic perspective. Even if there are disparities, it's important to identify racism, whether that be internalized racism or interpersonal, or if it's institutional or structural. All these should be explored in the research, in the discussion of the research. Also to explore the effect of other possible confounding factors like age, nationality, religion, or income, and explore the role of factors like stress, environment, and access to care. Again, we should avoid offering genetic or biologic interpretation for differences or for disparities. And these also to understand that these are not only limited to particular periods in life. If appropriate, solicit community input into the definitions of race and the potential causes of disparities in the research. Now for some very detailed race reporting suggestions. Important to avoid noun forms. I know we've heard some of that today. No Asians, blacks, Hispanics, but rather use those as adjectives, Asian women, black patients, or white participants. Also avoid hyphenation. And when we do say African American or black, though these can be used as descriptors, but they're not necessarily interchangeable. And it's important to know how people choose to be identified. When we can report the individual self-identified countries and not necessarily Asian American patients who group everyone together, but whether they be from India, China, Pakistan, Bangladesh. When we do report on indigenous to North American broadly, when we report on Native American or American Indian patients, it's important to classify based on how they want to be represented. Specify nations or peoples if appropriate, and then use the countries that designate particular collective terms for indigenous peoples, like First Nations in Canada or Aboriginals in Australia. So important to use it that way. And capitalize indigenous people of Canada, Aboriginal people. Latino or Latina used for people from South America and some countries also in Central America. Individuals may prefer to specify their country of origin, and this should be encouraged. Use specific terms, whether they're Cuban, Mexican, Mexican American, Puerto Rican, however they want to be described. Description of people as being of regional descent is acceptable if those terms were used in formal research, whether they be from Africa, Asia, or Europe. There are limitations to this. Racial identity is always evolving, and also there are limitations with some data collection tools, especially if coming from government agencies or Census Bureau. Some Latina respondents may prefer Hispanic as a race and not ethnicity. Others do not like that because of the colonial association with Spain. People from the Caribbean area may identify as black and not necessarily African American. And those with several generations of the US may identify as both. And it's important to take note of this in reporting the research. So in conclusion, systemic perspective to interpretation of racism and disparities in healthcare access and healthcare insurance. Also to understand that race is not biologic, and to explore racism as a potential cause of the disparity, and also to note the limitations of the data set that you're working with, what may be missing and what may be misleading about race. Thank you.